In some of the oldest models of work psychology, theorists proposed that how well we perform our job is the mathematical product of our ability and our motivation. Our technologies tend to enhance our ability. They help us work more efficiently, allow us to solve problems and coordinate. But I'm concerned that in the pursuit of ability-enhancing technology, we might have overlooked the performance equation's second half. We have to consider how this technology is affecting our motivation on the job as well. And theories of work motivation show us that each one of us bring our values into the workplace. Things like status, altruism, or teamwork. And when our jobs give us the opportunity to express those values by making a contribution to the team, being recognized, or making a difference in the life of another person, we're invigorated by the alignment between our inner held values and the work that we're getting to do. This is how job fit contributes to motivation. So how we update our work roles with the latest ability-enhancing technology matters, because if it disrupts those experiences of job fit, it could reduce our motivation. A sector in which this disruption is consequential and somewhat common is in healthcare, where this sector has raced to introduce an ability-enhancing technology called electronic medical records, or EMR. EMR is a tool that allows physicians to store and transmit patient information electronically. And this is really helpful, especially if you have a physician or a patient who's seeing multiple physicians or has complex needs, because without the ability to communicate, you might have physicians prescribing medications that negatively interact and harm the patient. But EMR can help everyone stay on the same page. You can see how this would be really useful. But even as recently as 2012, less than half of the hospitals in the United States adopted an electronic medical record system. Back when we were managing all patient information in hard copy, as you can imagine, the file cabinets were a little disorganized. One information systems scientist said that the US handling of patient information at that time was the most inefficient, cumbersome information enterprise on the planet. And that resulted in medical errors, the cost of which, according to the National Institute of Health, in 1 year was roughly $20 billion. So scientists asked if the health sector had introduced an information technology like what retail already had in place at this time, how much money could have been saved? The conservative estimates of that projection were roughly $80 billion a year. And because those savings come from efficiency and also patient safety, it's $80 billion, but it's not just money that's being saved. It was these kinds of projected benefits that spurred the integration of EMR across the country. Between the years 2008 and 2014, the percent of hospitals that adopted the technology soared from 9% to 97%. In a matter of 6 months, the technology moved from cutting edge to mainstream. And the good news is that patient outcomes did improve. But the promise of EMR might have been overstated. The sweeping gains that we hope to see in performance didn't materialize. And one reason for this could be that the improvement in ability came at the expense of motivation. After the technology was implemented, many altruistic providers found that their job had become more clerical and less altruistic than it was before. Physicians reported spending twice as much time recording patient information, and this amounted to roughly a quarter of their day spent implementing patient data into the EMR system. This reminds me of a story I once heard a physician tell of a time that she was playing doctor with her 3-year-old granddaughter. She was sitting on the patient bench waiting for the first questions of the consultation for a while before she turned to realize that the toddler was pecking buttons on the iPad. Confused, she just asked, "I thought we were going to be playing doctor." Equally confused, the toddler looked up and said, "We are playing doctor." So is that what it looks like to be a physician now? Is that how it feels to be a provider? Because many providers still hold these altruistic values and have a desire to impact the lives of patients through their job. But these new medical records can make the work feel less altruistic. EMR risks disconnecting providers from the motivational experiences, the altruistic experiences that are essential to job fit. And this could undercut their motivation. And it could undercut motivation in a sector in which that motivation is especially critical. Because the unrelenting work of healthcare can sometimes lead providers into a state of occupational burnout. That's when you feel like you're no longer making a difference in your job, or you feel emotionally exhausted by it. And when people experience burnout, they struggle to focus and concentrate. And this can undercut the performance of even the most disciplined and committed physician. Studies have shown us that physicians who are experiencing burnout are twice as likely to commit medical errors than those who aren't. They're also more likely to be named in malpractice suits. But the problems of burnout for providers don't stop once you leave the workplace. These physicians are also 25% more likely to report dependence on alcohol, and twice as likely as the general population to report suicide ideation. A 2016 report tried to help us understand the scale of this epidemic burnout in US healthcare, and came back reporting that roughly half of all physicians in practice experience some symptoms of burnout already. And roughly half of the physicians in training do too. So it looks like this problem is going to be with us for a while. Burnout is a state of demotivation. And if burnout contributes to medical error, then addressing provider motivation isn't just a question of provider well-being, it's a question of patient safety. And we know that providers experience motivation and reduced burnout when they have the opportunity to express altruism through their job to their patients. But EMR can make these experiences more scarce and feel less available. The technology can literally place a barrier between the patient and a provider, and it does call the provider to divide their attention between a cluster of tabs on a screen and the person who's there that needs their help. And this way, electronic medical records may make the experience of healthcare occupations feel less altruistic. So we need to think carefully about the way that our ability-enhancing technologies affect our motivation, especially in healthcare. Otherwise, we might risk removing the most motivating experiences of healthcare work with just paperwork. But there's also an enormous opportunity here, because EMR doesn't necessarily need to reduce these interactions to something economical or efficient. Certain scientists are designing EMRs now that don't just preserve those experiences of altruism and job fit, but enhance them. EMR can be a whiteboard for moments of health education, or a platform where providers and patients coordinate a care plan together. And that's the future of EMR. A technology that doesn't just enhance ability, but can enhance motivation. And enhance motivation by reconnecting providers to the altruistic nature of their work. Thank you.